Hey everyone, welcome back to another Intellect nursing video. In this video, we're going to go over post-traumatic stress disorder, or known as PTSD. We're going to go over the pathophysiology, signs and symptoms, risk factors, complications, and management. So let's get right into it. PTSD is the development of psychological stress and is characterized by three things such as hyperarousal, detachment, and re-experiencing thoughts. The main cause is commonly thought of soldiers, so soldiers returning from war, but it could really be any traumatic event that occurs, such as a weather event, a disaster, and they have stress from that event. So it is a response to a traumatic event, and it is a fear conditioning response. So the basic pathophysiology behind it inhibits the control of norepinephrine, which basically allows your sympathetic activity to go out of control. So what are these signs and symptoms of PTSD? So once again, those three characteristics, it's hyperarousal. So that could be hypervigilance, so always being very alert. So having anxiety, of course, difficulty concentrating, and then there is detachment. So that can be social withdrawal, depression, loss of self-interest, insomnia. And then that third characteristic was re-experiencing thoughts. So re-experiencing that traumatic event. So another common term is flashbacks. Another thing could be agoraphobia, which basically means they have extreme anxiety in certain places or certain things that remind them of the traumatic event, where if they do have an anxiety or a panic attack, it's not easy to escape. So complications from that, of course, once again, anxiety. They could have suicidal or homicidal ideations because of the depressive symptoms. Mood swings is common. Substance abuse is common because those are one of their possible coping mechanisms to deal with the stress. Impulsive behavior, so impulsive anger, impulsive depression. Impaired relationships due to the dissociative symptoms, they have social withdrawal. And of course, these patients have a hard time keeping a job because they have occupational or social impairments, so they are likely to have a lot of restrictions on having a normal lifestyle. Getting into the risk factors, of course, having a traumatic event is the main risk factor because it's related directly to a traumatic event. Lack of coping resources, if they have had prior mental health issues such as depression. And females are more likely to have this. They have a higher risk factor than males do with PTSD. So what are the diagnostics involved with PTSD? There aren't any labs or any scans that you can do that would confirm this. Of course, this is a mental disorder, but they must have those three characteristics that we talked about: hyperarousal, detachment, and re-experiencing thoughts. And it must happen for more than a month to rule out acute stress disorder. Now, of course, the interventions will be psychotherapy, so cognitive behavioral therapy, along with medications most likely, such as antidepressants. Beta blockers can also help with the hyperactivity or the anxiety, and anticonvulsants can help with the impulsiveness related to PTSD. So your main concern as a nurse at the bedside, of course, is always safety. So think suicidal ideation, so always assess for suicidal ideations, homicidal ideations, and look out for any impulsive behaviors or, of course, any increased stress going on in their environment. All right, guys, that covers everything you're going to need to know about PTSD for the NCLEX and your nursing exams. Really, just to highlight it, really understand those three characteristics: hyperarousal, detachment, and re-experiencing thoughts. A lot of the times the NCLEX likes to see if you can identify PTSD in the first place. A lot of times those management questions or diagnostics are not typically the focus. They really just want you to understand how to identify it. And then, of course, always think safety with these kinds of things. So always make sure that they're in a safe environment, they have coping resources available to them, and you'll do just fine on the exam. Thank you all so much for watching, and see you in the next one.